We were developing a breathlessness toolkit for patients and their carers, for patients with palliative medical conditions. So it was based on similar breathlessness brochures that were from the UK, and basically we just Australianized them. We added a couple of extra ones, and so it was a very clinical project in that we were basically just working on things that would improve patient communication. You might have been told all these things when you were sitting down and you were well and it wasn't really a problem, and you had all these strategies that you thought maybe you would use someday, but when you're actually feeling acutely short of breath, it's very difficult to think about anything other than breathing. And so that, like, to have strategies that you can work on when you're well so that you can use those as tools for when you're feeling very unwell and short of breath, is really important. Basically, I do ward rounds every morning with the medical team, and then in the afternoon I'd either just work on the project and work on our brochures by myself or with the nurse that I would be working with, or else we'd go do a home visit. She was very experienced in dealing with breathlessness and also experienced with patient education. So I was actually able to learn a lot from her. I also did a lot of clinical experience while I was doing this project. And so I spent a lot of time with the nurses and the just junior staff, doctors and medical staff that are at Bendigo Hospice. And there was one particular patient that one morning had just said, my biggest issue right now is learning about how to manage my breathlessness. And so it meant that, I was able to see patients that were very unwell in hospital, and we could, provide that education and brochures right there. And that was a really fantastic way to be able to apply it directly. Dr. Buddy, who is the doctor that kind of supervised the project, he had a really great style of teaching me, which was was very well versed on the subject himself, and he's very passionate about the project. Like, for instance, if I had, I'd have a particular patient encounter where I'd think, I think that could have gone better. He'd go, I knew that this would happen and that you'd have this moment of realization. Here's some reading. And so I'd go away and read, this journal article on a particular issue and how we could make it better. And it was a really great way to learn because, I got to, once I'd actually experienced it myself, then I got to figure out how it is addressed in real life. And it just meant, it became really relevant. And he said, if I had have just given all the information that I've read on the topic at the start, you would have been very overwhelmed and none of it would have really stuck. I really enjoyed that part of it. So a very supportive team that were really interested in what we were doing. A lot of medicine is about our communication. And prior to this, you learn a lot just from watching other people. But I had never just gone away by myself and read about how I could improve my own communication. And there's so much literature out there, and I feel a lot more equipped now that I am using, evidence-based communication strategies, and I'm hoping to implement those when I start working. I'd be very interested in doing more things like clinical research where you can directly be working with patients and improving that. I really enjoyed it.